can trigger glomerulonephritis. Next cause we can see is vasculitis. Vasculitis, what is vasculitis? It is nothing but the infection to the blood vessels. So if there is any infection to the blood vessels like polyarteritis or granulomastosis with polyangiitis, these are also causing infection to the the infection is carried to the kidney and is causing infection to the lungs. Next one is immune response. So some autoimmune conditions like lupus erythematosus we can see, Goodpasture syndrome, IgA nephropathy. These are some autoimmune diseases also can affect the function of the lungs and it may cause damage to the lungs. Risk factors, if we see hypertensive cases, diabetic cases, these are more prone to this condition. Next one is pathophysiology. In pathophysiology we see the antigens, the etiological factors enter into the body. So which enter, they will provoke the antibodies, they will stimulate the antibodies. The antibodies which are produced together, antigen and antibody, they form antigen antibody products. So in the circulation, the antigen antibody complexes will be formed and this antigen antibody complex will get deposited in the glomerulus, causing leukocyte infiltrate in the glomerulus. So this leukocyte infiltrate is nothing but the increase of the WBC count we can see due to the response of the immune system, due to the response of the immunity. So what it causes? This causes thickening of the glomerular filtration membrane. So when there is a antigen antibody complex, there is an increased production of epithelial cell lining in the glomerulus. So what this is causing? It is increasing the leukocyte formation and this will in return causing thickening of the glomerular filtration membrane. So this causes scarring of and loss of glomerular filtration membrane, causing decreased glomerular filtration rate. Pathophysiology, I'm repeating it again. When the antigen or the etiological factors enters into the body, streptococci or any drugs inhabitants hypersensitive cases like painkillers, it also affects the kidney function. So this will provoke the antibodies. So if any time if there is any antigen entering into the body, there is formation of antibodies in response. So this they together forms antigen antibody complex or antigen antibody product in the circulation. This causes increased production of epithelial cell lining in the glomerulus. So when there is a increased production of epithelial cells, so it is causing leukocyte infiltrate the glomerulus. So here chemotactic factors will are formed in response to the immune cells like neutrophils and the macrophages towards the infection site we can see. So these are deposited in the glomerular capillary walls, making the wall thickening of the glomerular filtration takes place, making the scarring and the loss of glomerular filtration membrane. So what is the main function of glomerular filtration? We can see is it will filter the proteins and the WBC, proteins and the blood cells, we can see. So this filtration capacity of the glomerulus will be decreased. So in turn, what happens? Decreased filtration rate will takes place. If there is decreased glomerular filtration, there is decreased filtration of waste in the blood, causing nephritis. Next we'll see clinical manifestations. In clinical manifestations, in both acute and chronic, we can see acute, the primary presenting feature is hematuria. Hematuria is nothing but blood in the urine. Blood in the urine we can see in the acute condition. So this may be sometimes microscopic, I mean only when we see under microscope, then only we can find it out, or sometimes it can be visible to the eye. Next one is cola colored urine we can see, because as we have seen there is filtration of RBC, red blood cells, and the protein will be decreased in the glomerulus. So this may lead to cola colored, blood in the urea we have seen. So there is a RBC present in the urine, so this gives a dark red to brown colored to the urine, known as cola colored urine we can see. Next is oliguria. So here what happens, the formation of urine, glomerular filtration rate is decreasing, and in turn it is the urine output will be decreased. So we see a clinical manifestation as oliguria. Next, if we see in chronic condition, so as there is filtration decreased, elevated blood urea nitrogenous waste we can see, and also serum creatinine levels will be increased. Feet are slightly swollen in the night. So why feet are swollen? Because there is proteinuria in the